Hello, anatomy colleagues. Let's talk the joints of the ankle region. So we're going to spend obviously the majority of our time when we're talking about the ankle region, talking about the ankle joint, but I do want to touch base regarding some of those tibiofibular joints. It's similar to what we had between the radius and the ulna with 3 separate joints. So there are going to be the 3 separate joints. There'll be a proximal tibiofibular joint, there'll be a distal tibiofibular joint, and then there'll be the interosseous membrane between. This proximal tibiofibular joint is a synovial joint, specifically a plane joint. There's very slight gliding movements occurring there. The interosseous membrane, as well as the distal tibiofibular joints, are syndesmoses. So these are examples of fibrous joints. They will allow a little bit of movement to occur there, certainly not to the level of what we had between the radius and the ulna. Excuse me, I'm losing my voice a bit. I did want to mention that the interosseous membrane in this region, as well as between the radius and the ulna, is going to be an important muscle attachment site. So I brought this up mainly because I did want to point out that we do have that similar setup in the leg as we had in the forearm, also because particularly the distal portions of the interosseous membrane and the distal tibiofibular joint can be damaged, sometimes in unison with the ankle region, and sometimes you will hear this referred to as a high ankle sprain if you have damage to some of those structures. Okay, let's talk about the talocrural, but more often we refer to this as the ankle joint. So recall that you're going to have these distal portions of the tibia and the fibula playing a role, particularly the distal part of the tibia here will articulate with the talus or the talus. And then we have, of course, the lateral malleolus and the medial malleolus on either side of the ankle joint, allowing for this kind of full complex between these bones. This is an example of a synovial hinge joint. So you'll have flexion and extension occurring here. But in this particular region, we refer to this as dorsiflexion and plantar flexion. So with dorsiflexion, you're going to have the dorsum of the foot being flexed. So the dorsum is this kind of top part. If you were to look down at your foot, you'd be looking at the dorsum of your foot. Then, of course, you have the plantar surface of your foot as well. So that's where you have the dorsal part flexing in this particular case. So think the toes are pointing up in the air. Whereas with plantar flexion, you're going to have your toes pointing down. Think of an individual doing ballet. They're standing on their toes. They are plantar flexing. You have some very powerful ligaments in this region as well, because you don't have a lot of muscle tendons, or you do have muscle tendons. That's not true. You certainly have muscle tendons associated with this region, and they do play a role in terms of protection. But ligaments are playing a bit of a stronger role in this particular joint. And they vary significantly, whether you're talking about the medial ligaments or the lateral ligaments. So the deltoid or the medial ligaments are going to be strong. They are going to play a big role in terms of protection of the medial side of not only the ankle joint, but some of the surrounding joints in this region. All of these medial or deltoid ligaments are going to kind of interweave together and attach to the medial malleolus or malleolus. Okay, so they interweave together, forming this block, basically, that's protecting that medial side. So it's protecting the medial side of the talocrural joint, but it also will stabilize the ankle during eversion. And we'll talk a little bit more about that in a moment, but you will see that you are capable of doing quite a bit more inversion than eversion. And that has a lot to do with the strength of these medial or deltoid ligaments. All right, now if you look at the other side, if you look at the lateral side of the ankle joint, you have ligaments here as well. In fact, you have 3 separate ligaments. They all attach on the lateral malleolus, but they don't interweave like what you had here on the medial side. So they are not nearly as robust, not nearly as strong, and they do not confer the same amount of stability as you had on the medial side. In fact, the anterior talofibular ligament is one of the most commonly torn ligaments in the body. And these ligaments not only protect the lateral side of the ankle joint, but they will stabilize the ankle during inversion. So what is this eversion and inversion that I keep talking about? Well, first off, these don't occur. This type of movement does not occur directly at the ankle joint. Remember, the ankle joint is a true hinge joint, but eversion and inversion often occur at the same time as movement of the ankle joint. So this will occur specifically at the subtalar joint, which is between the talus and the calcaneus, as well as with this transverse tarsal joint between the talus calcaneal region and the other tarsal bones. And so what inversion and eversion is inversion, you can think of the sole of the foot kind of turning more medially, whereas with eversion, the sole of the foot or the plantar surface of the foot, so this would be the plantar surface, is going to move more laterally. And if you invert or evert your own foot, you will see that you have quite a bit more of a range of motion with inversion than you do with eversion. So recall that those medial ligaments are really preventing over eversion, whereas the lateral ligaments are supposed to be preventing over inversion. But those lateral ligaments, recall, are not quite as strong as what you had. And so most ankle sprains are going to be due to an over inversion injury. That's by far the most common cause of an ankle sprain. So if you think if you're stepping down, say from off the street or something like that, and you land funny, often your ankle will move kind of oddly, and then you will over invert, and that can cause injury to these lateral ligaments. So these are by far the more commonly damaged ligaments of the whole body, but certainly in terms of the ankle region. Really, the ankle is one of the most frequently injured major joints of the body. All right, excellent. So this one is a real simple question, something I hope that we've gotten down. If not, we certainly need to make sure we review. So the talocrural joint is capable of plantar as well as dorsiflexion. What type of synovial joint is it? So pause the video if you need time. And when you're ready, I hope you have landed on C, hinge joint. So we have flexion and extension is capable at the talocrural or ankle joint, but in this particular joint, we refer to it specifically as plantar or dorsiflexion. So it's only this movement in this one plane that we have occurring at the talocrural joint. Certainly not a ball and socket, condyloid plane. That would not be enough movement. And then saddle is not correct either. All right, excellent. So those are the major joints of the lower limb that we are going to discuss. The rest of our time, we're going to be talking about the muscles associated with the lower limb, what they do, what they're innervated by, and then we will be finished. Thank you so much for your time, and I will see you in the next video.